listed. Here's what I have to say. Motor disorders are conditions in which a deficit in motor coordination or delay in meeting motor development milestones interferes with academic or daily life. These include developmental coordination disorders, stereotype movement disorders, and tic disorders. Tourette Syndrome, of course, is a tic disorder. And it is so much fun. Tourette's is so much fun because these people will do the same thing over and over and over again. There was a basketball player, what was his name? Raheem somebody. Anyway, played for Denver. And this guy had Tourette Syndrome. And he would have to hit, what was it, 50 shots in a row? If he didn't hit 50 shots in a row, he would start all over again until he hit 50 shots in a row. So this guy would practice like all the time. But sometimes he couldn't get out on the court because he also had to tie his shoes. And he had to tie his shoes perfectly. So he would start like a half an hour before game time, tying his shoes. And if he tied it incorrectly, guess what happened next? He had to re-tie his shoe, of course. So sometimes he would miss tip-off, which was, the coach didn't care about because he was such a good shot. Why was he such a good shot? Because he'd have to hit 50 shots in a row. So this guy could hit from anywhere. Anyway, he had Tourette Syndrome. He also was a little bit OCD. Nope, he was a lot OCD. He was really, really OCD. There you go. Motor disorders involves a deficit in motor coordination or delay in meeting motor development milestones interfering with academic or daily life. So this person doesn't move quite as well as everybody else. In the first grade, second grade, third grade, everybody knows who this kid is because they don't move as well as everybody else. One of the first things that happens, I don't know if you remember when you were in the first grade, but one of the first things that happens is that you compare yourself with everybody else in the class. Usually it's physical before you get into anything academic, so usually it has to do with running, jumping, throwing the ball, doing something physical. Well, these individuals are identified almost immediately by everybody else in the class. Potentially not the teacher, because the teacher doesn't care whether you can run fast or run straight or not run into a slide when you're running into the slide. Motor disorders are diagnosed with clumsiness is not due to a physical disability such as cerebral palsy, muscular dystrophy. Didn't we already talk about this? We already talked about this, sorry. Why did I think we started here? We're supposed to start here. Tics, we're supposed to be starting with tics, I'm sorry. So tics are a sudden stereotyped motor movement or vocalization that are rapid, recurrent, non-rhythmic, and experienced as irresistible. You can't help yourself. These are tics. There are simple motor tics like blinking or grimacing, and you may know people with this kind of a tic. My wife had a boss when she was stationed in Mississippi. She had a boss, and every time that he would be under stress, he would go. He'd pull up his pants with his forearms, and he'd suck in air, and he would do this. It just drove me crazy because I knew what the hell it was, and of course nobody else is noticing that this guy's going. Every time somebody asks him a question that he can't answer. It just drove me nuts. Anyway, that was a simple motor tic. Complex motor tics are hand gestures or twirling. Simple verbal tics are clearing the throat or grunting, and he also had a simple verbal tic. I had a friend that was, this is in Montana, I had a friend that was Nez Perce, and not that all Nez Perce have a problem like this, but he would, what would he do? He would clear his throat. So he would say something to you, then he'd clear his throat. So you knew when he was done because he would clear his throat. And this isn't the funny part, okay? This is really kind of the sad part. But whenever I talked to this guy, I'd start doing the same thing that he was doing. So every time I was done, I would clear my throat. Every time I talked to George, that's what happened. Complex verbal tics are words or phrases. The words or phrases may include coprolalia, anything copper. Does anybody know what COPRA means? It's like Latin or Greek or something. Copra. Coprophilic. If somebody's coprophilic, guess what they like? Guess what coprolalia is? Lalia means talk. So guess what coprolalia is? Copra. Once upon a time, and this wasn't very long ago, it was about 10 years ago, they found some coprolite in a cave in Oregon. They found coprolite. Guess what coprolite is? Copra. Okay. They found fossilized poop, okay? It was coprolite. So coprophilia is liking poop, okay? Coprolalia is being a potty mouth. Literally being a potty, or a poop mouth, I guess, in this case. Anyway, coprolalia. I know, it's just a fun word for poop. Write that down, fun word for poop. These individuals will blurt out obscenities. Usually it's in a socially unacceptable situation. If you've ever seen the movie Jumping Jack Flash, Whoopi Goldberg is in that movie, and at one point she starts swearing at a policeman, and the guy that's trying to get her out of the police station says, "Oh, she has Tourette Syndrome." What he means is that's why she keeps using the F-bomb. She keeps dropping F-bombs on this guy. And he didn't want her to be thrown in jail, of course. The DSM-5 includes 4 disorders involving either verbal tics, motor tics, or a combination of the two. One is Tourette's disorder, and this guy has Tourette's disorder. Persistent chronic motor tic disorder. He's not only making noise, he's making noise, and he also has a physical tic, has a motor tic. Persistent chronic vocal tic disorder and provisional tic disorder. So tic disorder is either both of them is Tourette syndrome or Tourette's disorder, and then you have motor disorder and vocal disorder. In Tourette's disorder, both multiple motor and vocal tics must have persisted for at least a year. And of course, my wife's boss, he was actually a veterinarian. I thought that was a little odd. And the funny thing was, when he was around dogs or when he was talking about animals, he didn't have the Tourette's. But when he was talking to people or dealing with people, that's when he had the Tourette's syndrome. It was really kind of funny. And of course, he didn't swear, but he grunted every time he tried to pull his pants up with his forearms, which you can't do, by the way. I mean, if you're going to pull your pants up, using your forearms isn't going to work. Anyway. Symptoms must have begun before the age of 18. Usually it begins by age 6 and can wax and wane in a course course that tends to diminish in severity as the person ages. So usually you grow out of Tourette syndrome, usually. The tics, which happen many times each day, cannot be attributable to a general medical condition or a substance. A lot of times when people have a brain injury or traumatic brain injury, they will develop a tic. And of course, this would not be Tourette's because the tic would have to do with the brain damage. In less than 10% of the people, coprolalia occurs. So Tourette's syndrome, as far as swearing is concerned, is not that common. However, we have rappers that seem to swear all the time, but they don't have Tourette's syndrome. It's part of their music. Strangely, I think, I'm guessing it's part of their music. Anyway, with my mother, she just swore. And yeah, she swore all the time. But she did not have Tourette's syndrome. She was very selective as to when she swore. And sometimes she swore at me. Persons with Tourette's disorder often feel discomfort, shame, or social embarrassment over the condition. Impairment in functioning is not among the diagnostic criteria for this condition. About 1/2 of the people with Tourette's syndrome also have ADHD. What a shock. Tourette's disorder also may co-occur with obsessive compulsive disorder. I was just talking about somebody with obsessive compulsive disorder. Didn't I say somebody had obsessive compulsive disorder? The basketball player. Yeah, basketball. Thank you. I couldn't remember all the stories I I was telling her, I couldn't remember. Yeah, the basketball player had OCD as well. The stimulants used to treat ADHD have been associated with an increased tic incidence and severity in some studies, and this is kind of a problem. So we're treating, what do you treat the person for? For the Tourette's or for the ADHD? Which do you treat them for? Which is worse? And that's what they're doing. They're treating them with ADHD and their Tourette Syndrome is what it is. Yeah. So at that point, you have to decide which direction am I going. Do I treat the ADHD or do I treat the Tourette's?
Both, not at the same time. 3 minutes, and then the other 3 minutes.
Actually, usually if you try to stop one of those treatments, you get a rebound effect. Yeah. So it gets worse. Wow, this is a tough one, isn't it? I don't know. Would you treat their ADHD or would you treat their Tourette's? This is one of those toss-ups. This is a relatively new thing. For the longest period of time, nobody cared. I almost said didn't give a shit, but I didn't say that. What I said was they didn't care. So they didn't even notice that they were causing a worse reaction with the ADHD. I'm sorry, with the Tourette Syndrome, by treating their ADHD. They just ignored it. And finally, some doctor went, I think maybe we're making them worse. You know how doctors talk. They think they know everything, and sometimes they don't. Anyway, so finally somebody noticed. Thank goodness. The diagnosis is given to men between 2 and 5 times more often than women. It is a rare condition. An upper prevalence estimate is about 8 school children per 1,000. If you think about it, I don't know. Does anybody know of anybody with Tourette Syndrome or a tic disorder? No? Have you ever seen anybody with a Tourette Syndrome or a tic disorder? Okay. There appears to be a substantial genetic component to the disorder. Recent randomized controlled trial found behavior therapy to be as effective as antipsychotic medications for treating Tourette's disorder in children. Now remember, what does an antipsychotic do? What does it do to you? It's a heavy sedative. Okay. Okay. I'm going to call it's not Tourette's. Okay, that's good. Okay. So Mo starts coughing, and so we start treating her with an antipsychotic, and now she can't swallow her apple because, well, you're too sedated to swallow your apple. But for a while they were doing that with these individuals, and it's really kind of interesting that they were treating them with stronger and stronger stuff until they found something that actually worked. And it took antipsychotic. That's a good idea. Move that back. So they were treating them with stronger and stronger sedatives until they found something that worked. And as it turned out, it was an antipsychotic that worked. So here's the other question for you. So you've got a kid with Tourette Syndrome. Are you really going to sedate them with antipsychotics? I don't know. Would you treat a child with antipsychotic medications just so that they stop going?
Yeah, if it calms them down.
If it calms them down, okay. So he doesn't have to. Would you?
Sure.
Would you treat him with an antipsychotic? Oh, I didn't tell you that. It makes them dumber.
Yeah, it just says calming and sleep inducing effect.
Probably depends on the child, how old is that child.
Well, how disruptive it
Yeah, and then the child is.
is. The other question is how functional are they going to be after this? On an antipsychotic, how functional are they going to be? What do you think? Or would you go ahead and juice them up with the antipsychotic?
No.
Okay.
What
Just
if you
curious.
live in Colorado and you just give them a small slice of gummy bear?
Give them a slice of gummy bear. You know, marijuana works on everything. I know it's a very good drug.
Tiny bit.
Let me think what would happen if you gave them marijuana with Tourette syndrome. Nothing.
Nothing.
I don't think anything would happen. It wouldn't take the Tourette syndrome. But if you smoked the marijuana, you wouldn't care that the kid was. Would you juice him up with the antipsychotic? Okay. I don't know. Well, we treat kids with ADHD with Ritalin. Would you hit them with the antipsychotic? With doses? Smaller doses? It's not going to work. They've been hitting this kid with stronger and stronger sedatives until they got to the point of antipsychotics. Would you hit them with the antipsychotic? No? I don't know. This is a tough one, isn't it? And we're not treating those with antipsychotics. But I'm a little afraid of letting her cut that apple with a knife. But I guess we'll be okay. Persistent motor or vocal tic disorders involves either multiple vocal or motor tics, but not both. Remember, if they have both of them, it is Tourette syndrome. So, persistent motor or vocal tic disorder differs from Tourette's disorder, which requires, of course, presence of both of them. Like Tourette's disorder, the symptoms must persist for a year, and the onset has to be before the age of 18. Normally, if we see a motor or a vocal tic disorder or a Tourette syndrome after the age of 18, it's due to a traumatic brain injury. So it usually has to do with that problem. It could also be a drug. So if you used crystal meth, shot up with heroin, even if you smoke marijuana, potentially you get one of these tics.
What are the names Tourette's?
Excellent question. It's a capital letter, so I'm guessing the first guy was a Frenchman named Tourette. Okay, that's just a guess. But I'll bet you if you look it up, that's what you'll find. It's a guy named Tourette. 4 DSM-5 classifications of communication disorders: language disorder, speech, sound disorder, childhood onset fluency disorder, which you know as stuttering, social pragmatic communication disorder. I was talking to an individual just today, and he was saying that his father was in a head-on collision when he was in the Army, and he not only flew through his own windshield, but he flew through the other guy's windshield at the same time. So he hit two things before he landed in the guy's back seat. He survived, but now he stutters. There was that kind of brain injury done with the automobile accident. The other one is social pragmatic communication disorder. All communication disorders occur more commonly among males than with females. Yes, ma'am.
I know somebody that stutters, and I know like they had a.
Is it a guy? Or
It's a guy.
Of course it's a guy. It's always a guy.
It is, yeah. And then like he had authoritarian parents.
Oh, okay.
Yeah.
Okay.
So really, so I think that's where he might have
Right.
stutter because of the way you have to say things
Sure.
a certain way.
Exactly correctly. And if you don't say it correctly, you have to say it again. And then you're afraid to say anything at all. So then when you start to say something, you worry about what you're going to say. And now, all of a sudden, you have to stutter. Yeah, that makes sense. It's very logical. Stuttering. Lots of different causes. Okay, so it occurs more commonly in males. These disorders also appear to aggregate within families, although specific genetic, neurological, environmental causes are unknown. The possibility is that he wouldn't have stuttered had he been in a less authoritarian family. Yeah, right. So there are many different causes for these problems. Some of them are social, some of them may be environmental, and some of them may be genetic. And some of them may have something to do with brain damage, just like with my friend's father who flew through the windshield of a car. Language disorder involves language use and acquisition that is substantially below the level expected. shown by limited vocabulary, word recall difficulty, shortened or overly simplistic sentences, and errors in verb tense or a deficiency of understandable discourse. A lot of reasons for messing up. Okay, what was I talking about? Well, see, I couldn't think of the word. I couldn't think of the basketball player. I just told that story. I couldn't think about it. You think maybe I have a language disorder? Or as Mose says, it's just my old age. Thanks, Mose. Receptive communication may also be affected involving difficulties understanding words, sentences, or particular types of word phrases, such as if-then statements. One of the things that happens to you if you have a blow to the head, one of the things that we will do is we will try to get you to understand what we are saying. How many fingers am I holding up? Okay. 3, good. Not only do I want her to be able to see 3 fingers so that I know that the visual portion of her brain is good, but also I want to know if you understand what I'm saying. And then I probably ask you a stupid question like, who's the President of the United States? Or what day is it? It's Wednesday. Yes, it's Wednesday. And the reason I'm doing that is because there are areas of her brain that interpret what people are saying. And for that reason, of course, like if you have a blow to the head, I need to know if you understand what I'm saying. And that your vision is okay. Holding up 3 fingers. Okay. Today's pick on Mose Day. She has a cold, so she's weak. Exactly. And a tick. She has a tick. Expression of written language, spoken language, and sign language can be impaired with these individuals. As interesting as that is, you would think that spoken language, that makes sense. Yeah, they can't read very well. They get their letters mixed up in their brains, but also they don't understand sign language. I can't do sign language. I mean, they can't understand it. It's like when they interpret it upside down and backwards, just like they're doing with written words. The course is variable, although some difficulties tend to persist into adulthood. Those with receptive language deficits appear to have a poor prognosis. So if it's information that you're receiving, if you have a problem with receiving information, then it's much more difficult to deal with these individuals than if they have to do something in their brain themselves. So if it's projecting language, it's much easier for them to cure themselves than it is for them to understand what's coming in. If you've ever got a telephone call or you called up the center to fix your IT stuff and you got a hold of somebody in India, and when they first start talking, you don't understand a word they say because they speak with a different accent, and sometimes their vowels are not exactly pronounced the way that we pronounce them. Maybe, it's a lot of times it takes you a couple minutes before you can actually understand what they're saying. Did you go out and get him?
Yeah.
Good job. Good. I'm always glad to see Shelby. Well, sometimes. Glad to see. Okay. Anyway, so there's poor prognosis with receptive language. Speech sound disorder is an articulation disorder in which persons fail to use the speech sounds that are normal for their developmental level. This usually has to do with pronouncing R's and L's. Sometimes it's vowel sounds that they can't pronounce. But usually by the first grade, whatever their speech impediment is, it's gone. So most first graders can actually make those sounds. I have a brother that can't pronounce R's, doesn't pronounce R's. He's had a problem almost all of his life, but then he went to war when he came back. When he came back, he actually had lost his speech impediment. As interesting as that is. And the reason is because when he was calling something in, he had to be very articulate because pilots are kind of stupid and they don't understand things very well. And if he gave them the wrong word, usually it's something that is exactly, they're going to bomb you instead. And for that reason, it forced him to start speaking correctly, and now he pronounces his R's without a problem. For 18 years, he had a speech impediment. And once he went to war, he came back without a speech impediment. Because he was the one that, well, he was smart. So he could actually read grids, or it was beyond me. Oh, sorry. Let's pick on Mo's there today.
I say the same thing.
And pilots are stupid too, so. Difficulties may occur in knowledge of the correct phonological sounds or in the motor coordination requiring for speaking. So we hear a lot of people who lisp. Lisping, yeah, they can't quite get that quite right, so they lisp whenever they say at the F. They put their tongue in the wrong place against the top of their teeth, the bottom of their teeth, so they lisp. So a lot of people are lispers. Speech therapy is helpful and articulation tends to improve over time. They teach you where to put your tongue so that you pronounce things correctly. And I guess that's what happened with my brother. I have no idea. I can imagine the first time he called in the wrong thing, the second time he didn't, is what my guess is. And he survived for a 13-month combat tour. So. Evidently it was something. If language disorder is also present, the prognosis is less optimistic, of course. It's easy to teach people how to speak correctly and not lisp or have a phonological problem. But of course, if they have an understanding problem, it makes it a lot worse. Stuttering is a disturbance in speech fluency. It's typically characterized by speech blocks, repetition of words, or repetition of syllables, and prolongations of speech sounds. Sometimes they'll get stuck on S's, R's, or they get stuck on R's, P's, they'll get stuck on those. B's are hard for some reason, so they'll get stuck on select consonants. Difficulties increase under conditions of stress or anxiety. Approximately 1% of children are persistent stutterers, and another 4 to 5% show transitory stuttering when young but outgrow it in time. My grandson stuttered for a time, and the reason he stuttered was because he would call his dad up on the telephone. His dad's in one place and he's in another place. He'd call his dad up on the telephone and he would start to tell him something, and his dad would try to, kind of like the authoritarian parent, his dad would try to get him to say it faster, because it's costing his dad money. And there's nothing worse than spending money. If you're a wealthy person, you hate to spend money. So you don't want to spend any more time on the damn telephone than you have to, especially if the kid's not saying anything, right? Oh, God, I could punch him in the face. Like, money's the most important thing in the world, right? This guy's sitting there with millions of dollars, and what is he worried about? He's worried about a $25 telephone, right? I just lost a check for $200. I lost it. I don't know where it is. I lost a $200 check. What am I going to do? Don't eat it. I don't have it, okay? It's not there. I can't find it. Am I worried about my $200 check? No. Is this guy worried about a $25 telephone bill? Yeah, and he's sitting on millions and millions of dollars. Rich people just drive me crazy. I'm sorry, I didn't mean to insult you. Childhood onset fluency disorder almost always starts before the age of 8, but can be coded for adult onset. Usually the onset is gradual, so they'll start stuttering as they get older and they get in more important positions. Potentially, I was in a meeting today with my new boss, and if he had asked me a question, I might have had a problem saying what I wanted to say, but I didn't. Because I don't care. I'm 70 years old. What the hell do I care? What's he going to do? Fire me? You're so old, like you can't be a teacher anymore. Oh, okay, just go on home. That's what I'll do. I'll just go on home. In families in which the father has a history of stuttering, 10% of the daughters and 20% of the sons will stutter as well. Half or more of the individuals who begin to stutter will recover with little or no professional help. So you really don't have, it has to do with stressful situations. They will stutter in stressful situations. They can fix themselves. You know, it just takes them readjusting things in their brain. Just like my brother with his R's. Yeah. Yeah, he's calling it an airstrike. Yeah. And it's an extremely stressful situation. They're under attack, and if he doesn't call in the strike correctly, they bomb the wrong place. Or they bomb them, which is even worse. So he fixed it. Almost instantaneously, he fixed it. And he brags about it to this day, which I find kind of curious. He also used to talk very, very loud. So he was fairly inappropriate. Somebody'd ask him a question and he'd go, okay, I think this is what it is. He didn't understand how to modulate his own voice, as curious as that is. But he cured that in the Army. Because in the Army, if you yell at your TI or DI or whatever you have, then usually makes you do push-ups or something. According to the DSM-5, 65% to 85% of stutters recover from the disfluency, so they usually don't die with stutter. The interesting thing is, a good case of a person that stuttered when they were a child is James Earl Jones. He's Darth Vader. He's also the guy on the Arby's commercial. Has a very deep, sonorous voice. Wonderful voice, but he used to stutter. Now the probability is that as he gets older, and if he gets Alzheimer's disease, or if he starts drifting into dementia, guess what's going to happen? He will start stuttering again. It's kind of interesting. Stutterers report substantial reduction in stuttering when engaged in a number of different activities. They can sing and not stutter, as curious as that is. When they're speaking to an animal, they don't stutter. They only stutter when they speak to humans. When they speak to infants, they don't stutter. When they swear, they don't stutter. Did I stutter? I know. Swearing is really, can be cathartic. The reality, and I think I told you guys this before. Okay, yeah, it can be cathartic. I know you're not supposed to swear. Somebody's going to wash your mouth out with soap. But the reality is it relieves tension. And if that's what happens, I mean, that's one of the reasons why, everything was an F this and an F that when you were in Iraq, right? Yeah, everything. I mean, everything, right? To relieve tension. Speaking to a rhythmic swing or of your arm or foot tapping. You can tap your foot, you can swing your arm, and the interesting thing is just movement will stop the stuttering. It will control the stuttering. Imitating a regional or foreign dialect. If you stutter with an American dialect, if you try to speak like an Australian, you stop stuttering, as curious as that is. Anyway. Interesting stuff. Delayed auditory feedback is a technique in which the stutterer's speech is played back through earphones with about a 1/10 of a second delay. This started about 15 years ago. And actually I was kind of in on when they first started doing this, because we had stutterers wherever I was. Where was I? I was in Omaha, I think. Anyway, they started using this feedback technique. And in the beginning, of course, it was really expensive. Now it's not nearly as expensive. But it really works. The stuttering is completely suppressed. And all they do is they play back what you're saying to them, to yourself or to somebody else, at 1/10 of a second delay, which isn't very much of a delay at all. And of course, you can control your stuttering. Regulated breathing during speech. Subjects practice speaking during natural exhalation. Improvement was significant and sustained for all children outside of the treatment setting. So if we can teach them techniques, then we can get them to stop stuttering. Social communication disorder is new to the DSM-5. Basic practical social communication skills such as greetings, taking turns in conversation, asking for clarifications, or matching speech styles to the context of the listener, such as playground or classroom, are impaired. This is one of the problems that my brother had. He would speak inappropriately, so when he was in the classroom, sometimes he'd be yelling, and of course the teacher would tell him, stop yelling, and then suddenly he stopped talking completely because he was inappropriate. He was always inappropriate. Really kind of interesting. Social communication disorder is not due to an intellectual deficiency, autism spectrum disorder, or other mental disorders, but does occur more commonly in families that have histories of autism, communication disorders, or learning disorders. So it's really kind of an interesting one. Can you cure somebody of this problem? Yeah, no problem, no big deal. All you do is you get them to think about how they are speaking when they're speaking. You get them to think about speaking. They have to concentrate on it. They don't want to whisper. There's somebody that whispers. Who's a whisperer? They always talk too quiet. I can never hear them. Who is that? It's one of your teachers. They drive me crazy.
No.
Is it me? Could it possibly be me? Is it Sarah? Does she do that? Does she get quiet all of a sudden? Is it Sue? There's somebody that does that. Drives me nuts. Maybe it was somebody in another place. I don't know. I can't remember. I used to have a boss that the way that she would get you to listen to her was by talking really quiet. It was her way of controlling the situation. It was by whispering. And everybody would, what? Drove me nuts. DSM-5 the DSM-4's pervasive developmental disorders were combined into a single spectrum disorder. This really pissed people off. I apologize. It's not my fault. I didn't have anything to do with it. I didn't want it to happen. I wrote a letter to the APA, and they immediately tore it up and burned it, I'm sure. Maybe they urinated on it before they burned it. I'm not sure. But they didn't do anything about it, okay? And the reason is because there used to be two types of autism, Asperger's and autism. Asperger's was low-level autism, and then there was autism, right? Well, they decided that they'd put the two together, and they would create this strange concept of a spectrum. So you can have almost a little bit of just a little bit of autism, or you can have a lot of autism, but they call it the same damn thing. And for that reason, if somebody has autism spectrum disorder, you don't know where the hell on that spectrum it actually is. And that really upset people who had kids with Asperger's syndrome. We have already talked about people with Asperger's syndrome. I told you about my son going to that party with all those professors, and 4 of them couldn't even make eye contact. Obviously, they got Asperger's syndrome. One of them was hiding behind his computer. Obviously, he has Asperger's syndrome. Is he a good teacher? Yeah, but this is mathematics, okay? So when you teach something like psychology, your voice gets loud, and gets quiet, and you modulate your voice. But in mathematics, you don't have to do that. That's a 6, it's a 7. Oh, I think that was a 4. You don't have to do that in mathematics. So these guys are pretty good instructors, but they obviously have Asperger's syndrome. When you go off to graduate school, or ASU, to get your bachelor's degree, when you go off to another institution, you're going to run into these guys. And you're going to say, Bradway, maybe Bradway had a problem. My problem is I'm an old man. But you're going to say these guys have Asperger's syndrome. You're gonna have somebody that's up there and they're reading your notes and they're talking in a monotone, and this is all that, this is the way they teach things. I had a friend with Asperger's. I think I told you the story. He's the one that had sex with my first wife. But he has Asperger's syndrome. He's got Asperger's, and he's a friend of mine. He probably didn't even know what he was doing. He's such a goofball. Anyway, he's got a PhD in literature, in English literature. His area of study is pre-Victorian literature. It's the most boring. Oh my God. It's the most boring stuff in the world. But everybody loves him because he's so pretty. I mean, that's the reason everybody is with glasses. His hat. Anyway, that's my friend John. He has Asperger's syndrome. John can sit in the middle of a party with all these naked people running around and screaming and all this music playing, reading a textbook. That's John. He can concentrate that way. As goofy as that is, I see everything that happens. John sees nothing that happens. The only way to get John to hear you is make sure he's making eye contact and talk right at him. That's the only way to get John to acknowledge you. Just the most bizarre thing in the world. So if you ever go to the University of Montana, after ASU, his name's John. And he's a very attractive man. He's far more attractive than I am. It's really kind of distressing. He's as old as I am, so maybe he's going to retire soon. Anyway, he's got Asperger's syndrome. And we're going to see a lot of people with that. You're going to see a lot of people with Asperger's syndrome. Just the way it works. Because that's, and doctors, you're going to see doctors, medical doctors with Asperger's syndrome. It's just the way it works. She has Asperger's? Oh, you know John? Autistic disorder, Asperger's disorder, childhood disintegrative disorder, and pervasive developmental disorder, now otherwise specified, are now combined into the autism spectrum disorder. So in the old days, they used to have two different types of autism. Now they have a spectrum disorder, and you don't know where they fit on the spectrum. That's the problem. So now they're diagnosing people with autism spectrum disorder. Can they not concentrate on any, or can they only concentrate on one thing and you can't get them to pay attention to you? Do they have language difficulties? Do they have severe autism is the question. Or do they have Asperger's syndrome, where they're fairly functional, relatively functional? That's the question. And that's why the people that have children with Asperger's syndrome, that's why they're so upset. Because autism is a disability. Asperger's is not. You can function fairly well with Asperger's syndrome, but you can't. There are a lot of people with autism who it is so severe that they are fairly non-functional. They have a difficulty functioning. Autism spectrum disorder involves problems in social interactions, communication, or play. There is little social reciprocal interaction. In autism spectrum disorder, language is usually delayed or absent. Well, this is true for people who have the more severe forms of autism. Some of them will never learn to speak. In the old days, they didn't learn to speak, but now we know how to train them. If you are dealing with somebody with with autism, the thing that you need to make them do is to listen to you. You have to get in their face and you have to force them to hear you. One of the ways to do that is to touch them. If you touch them, they have to listen to you. So this is the way you have to treat somebody with autism. One of the reasons that I was so bad when I was in the military, I was a terrible leader. And the reason I was such a bad leader was because I wanted everybody to like me. I wanted everybody to do the right thing. I couldn't boss people. I can't boss people. I really have a difficulty. I have a hard time grading your stuff, okay? I really do. I give everybody A's, and I apologize for that. Maybe you don't deserve an A. Maybe I should give everybody a C. But I give everybody an A, except when I grade the papers, because then I can do the grammar grammar thing? Yeah, and if you screw up on your grammar, I'm gonna give you a bad grade on your grammar, because I was an English teacher before I was a psychologist. Anyway, okay, so I was not very good at being in the military because I can't boss people around. I have a really hard time bossing people around. Why am I telling you this story? Oh, this has something to do with autism, I can't remember why. Okay.
You said you have to touch them.
I'm sorry? Oh, you have to touch it, yeah. Yeah, but when you're dealing with somebody with autism, now maybe I can't deal with somebody with autism because I can't boss people around. But you have to do that. You have to be very strict with these individuals. You have to touch them. You have to tell them to do what they need to do. And if they don't do it, you have to stay with them until they actually get it done. Now, I can't do that because, you know, when I was in the military, if somebody did get something done, guess who did it? Yeah, exactly. I did it. But if you're dealing with somebody with autism, you can't do that. If you let them slide, even a little bit, then they're not going to learn. I mean, they have to do the same thing every time, and you can't let them not do it. If it takes you all night to get them to pick up this toy and put it in the bin, then you have to stay with them all night long. Keep telling them, you've got to pick that up. You need to pick that up. And you have to do it in a firm voice. You know, that's hard for me. I can't do that. I can't yell at people. Well, I can, but it doesn't happen very often. Anyway. Okay, so Chris, this is what I work with. That's how you have to do it. You literally have to touch them. And if you touch them with both hands, you're in better shape. But you have to be somebody that they will allow you to touch them. Because a lot of autistic people who are suffering from autism spectrum disorder, a lot of times they only have select individuals, they have select routines. And what you have to do is you have to break that routine to get them to create a new routine. One that doesn't do any damage to them. So sometimes you have to grab them with both hands. But only if they will allow you to do that. Has anybody been around somebody with autism? No? Curious reality is that on the other reservation, up in Fort Belknap, autism is relatively common. Unfortunately, it's way more obviously than it is here. It's way more common. So maybe they have a genetic proclivity for that. What are we doing here? There are narrow ranges of interest in activities. If you've ever seen Rain Man, it's actually a very good movie. I mean, that's really the way autistic people are. Yeah, Rain Man, because he had to do the same thing every day. And he would repeat the same thing over and over and over again. And that's the way, if they can talk at all, then potentially they will repeat the same thing over and over again. And if you do something out of sequence, they get really agitated. That's one of the reasons why you have to train them to change their routines. But you have to go incrementally. So you have to do things as slowly as they can learn. Stereotypic movements are often present, where they'll do the same thing over and over again. If you remember the movie Rain Man, he would use a toothpick to pick up his Cheetos, or those cheese balls. Remember? And if he didn't have a toothpick, he couldn't eat the cheese balls. So he had to have the toothpick in order to pick up the cheese balls. He had to watch the not Judge Judy, it was the other guy. Whatever, yeah, this is an older movie. Yeah. Really fascinating stuff. A lot of times movies are fantasy, but in that case, of course, that really taught you what an autistic person is and how they function. Very stereotypic movements. The severity of autism spectrum disorder is specified by the degree of deficits shown, indicated by requiring support, difficulty initiating social interactions. This is fairly severe. Requiring substantial support, marked deficits, even with supports in place, frequent and obvious repetitive behaviors, requiring very substantial support, minimal response to social overtures, repetitive behaviors, markedly interfere with functioning. I've been teaching this class for 25 years. And when I first started teaching abnormal psychology, one of the figures that comes out to me is the fact that when I used to teach about autism, I would say that 70% never learned to speak. And that was true. Back 25 years ago, 70% of people never learned to speak that suffered from autism. It's not nearly that bad now. And the reason is because we've learned how to deal with these select individuals, how to train them. In the old days, you didn't force them to do anything. But now we know you have to force them to do everything. But you have to be somebody that the individual can communicate with. When I was up on Fort Belknap about 15 years ago, there were a set of twins, and both of them were autistic. And I had a student that was actually one of their trainers. And she, of course, when we talked about all of this stuff, that was a relatively new program at the time, but she had learned that there were only select individuals that could train these individuals. They wanted the mother, the father, one of the siblings, and her to be the trainers for these individuals. Guess which one was the best trainer? Guess which one was the best trainer? You got mom, you got dad, you have brother. It was her brother. It was their brother, and it was the lady in my class. So guess which one was the best trainer?
The brother.
I'm sorry?
The brother.
The brother. It was the brother. And it was because when he looked at that kid in the eyes, the kid would look back at them. If it was the mother or the father, of course, a lot of times they were chastising the child, so the child wouldn't react to them. The mother and father and the brother, of course, were interacting with the child far more frequently than the trainer was. So the trainer was able to actually interact with the child, but the individual that was the best at interacting with him was the brother, because he was on the same level as the two kids with autism. The interesting thing was, if they had problems with one of them, then the brother would train one brother, and that brother would train the other brother. They were all three boys. It was really kind of fascinating. And guess what that brother does today? The brother that was the sibling that was the good trainer. He works with autistic children. Yeah. It's really kind of fascinating. Okay. Infants may show an indifference or aversion to physical contact and a failure to respond to the voices and social invitations of their parents. If you've ever been around an autistic child, if you pick them up, normally a child can't see very well, but they will cuddle with you. I mean, if you pick them up, they will cuddle. Almost all babies cuddle, but these babies don't. They stiffen up when you touch them. There's already something going on in their brains that won't allow them contact comfort. They don't recognize it. Most also have some degree of intellectual disability, but the level of cognitive skills is uneven across abilities, and this is really kind of difficult to measure. The problem is how much intellectual deficit do they have, or how much intellectual disability do they have. The problem is you can't get that kid to take the test. They can't, or sometimes you just can't get them to do mathematics. Or sometimes you can't get them, they don't have any speech, any language skills. So how in the world do you measure this? So this is the biggest problem. In the old days, when 70% of these individuals never learned to speak, we thought that they all had intellectual deficits. That they all had disabilities. But the reality was that we just couldn't communicate with them. And if you can't communicate with them, how in the world are you going to get them to react to an IQ test? About 1/4 of the people with Fragile X syndrome meet the diagnostic criteria for autism spectrum disorder. So this is another disability that we're talking about. Its presence is associated with lower development and generally poor outcome. In the DSM-5 field trials, pooled reliability for autism spectrum disorder was very good at 0.69%. Okay. All right, so we're talking about autism spectrum disorder, and it's really high at 0.69%, or 0.69. Any guesses as to why it's so damn high? Remember, a very large percentage of these people aren't really autistic, or what we used to call autistic. They really have Asperger's syndrome. People with Asperger's syndrome can concentrate on something when all this chaos is taking place around them. So a lot of times these individuals become very focused on one thing, or very focused on two things, or very focused on select things, whatever they're interested in. So they become geniuses as far as this is concerned. So it's real easy to pick out that kid with Asperger's syndrome. As a matter of fact, teachers love kids with Asperger's syndrome. They love them because they don't make any noise. And they can get them to do something really, really well. And usually that's something that they really have to use their brains for. So it could be a science, or it could be mathematics. So these kids are really easy to pick out. And these are the people that the teachers really love, because they don't cause any problems. They don't make any noise. They don't sit in the back of the room. Well, they do sit in the back of the room. Okay. Well, I'm thinking on Edison again. He's not paying any attention to me, so what good does it do me to pick on him? And Sheldon's in the front today, so okay.
Front of the race.
Exactly. Autism spectrum disorder. Autism spectrum disorder is at least 4 times more common in males, although females are more likely to show intellectual disability. Okay, so when we see it in females, the prognosis isn't nearly as good. But as far as males are concerned, a lot of males with Asperger's syndrome. A lot of them are very important people. You wouldn't want one to be the president of the United States. That wouldn't work very well. You see, wouldn't have any charisma. These individuals tend not to have charisma, but they do know their subject material. They know their material very, very well. They may be OCD as well as have Asperger's syndrome. And they'll drive you nuts. They drive me nuts. Prevalence rates have increased from 1 to 2,500 to 1 in 500 in the past 20 years. What happened in the last 20 years? What has happened? Why do we have so many kids with autism spectrum disorder? When did the DSM-5 come out? 2013? All those kids with Asperger's, all of a sudden they've got autism. All of a sudden we've jacked up the number of people with autism from 1 in 2,500 to 1 in 500 because we changed the criteria. Oh my God, all these kids with autism. Oh my goodness gracious, what's happening? We must be poisoning people. We must be putting cyanide in the water or something. Everybody's drinking uranium. Nah, it's just that we changed the criteria. Some may have particularly strong, DSM-5 estimates the disorder frequency at nearly 1% of the population. Some may have particularly strong abilities in very narrow areas, and these individuals are called savants. We used to call them idiot savants, but we don't anymore because idiot is kind of an insulting term. So now we call it savant syndrome. They have the ability to focus on something, and usually it's something very complex that they have to use their brains for. They have to, like mathematics. I told you about my son, I didn't understand a damn word the kid says because he's talking in mathematical terms. I don't understand that stuff. Or sciences. They become doctors. They become lawyers. Not lawyers. Lawyers have to have charisma, right? They become college professors. The most boring college professors in the whole wide world. Wait, when you go off to someplace else, we're kind of fun here. I mean, some of us are. But when you go to ASU, you're going to run into these guys. And you're going to call me on the telephone. You're going to say, my God, I've got a professor, he's a mathematics professor, and the guy does not make eye contact. He will not look at anybody. He just stands up there and he writes stuff on the board. You're gonna see, it's gonna happen, I'm telling you, it's gonna happen. It's not so much, not so frequently with people that are psychology professors, because we're fun, right? We get to talk about sex, right? But science people, oh my God, they're so bad. I think we've got one here. I was lifting weights with a guy. He wouldn't look at me. He wouldn't make eye contact. But he said hello. He wouldn't make eye contact. You'll see. You'll see. Just wait until you go away from here. What are we doing? Somebody have particularly strong ability. Okay, that's the savant syndrome. And this is real. I mean, we see this all the time. But it's only about 10% of the individuals that will be savants. If you remember the movie Rain Man, his ability was to count cards. He was a math whiz. He could tell you what day of the week. You could just give him a date and he could tell you what day of the week that was. I mean, his brain was that organized, and that is the way that people with autism usually are. This is a famous person with autism. Her autism was relatively severe. She never learned to speak, but she was able to draw. She was able to draw animals, and she was able to draw animals. She couldn't draw humans. Not very well. And there were other things that she couldn't draw. And if we look at these pictures, we can see what that is. This looks like a chicken, and this looks like a rooster. This looks like a horse. This is a really good drawing of a horse, but look at the guy. My goodness gracious. She had problems with, look at those pictures and tell me what she had problems with. Remember, this is a lady with autism. She never learned to speak. What did she have problems with? With people, for one thing, but a special part of it. I'm sorry?
Men. Facial.
Well, we only have a picture of a man. You're right. It was the face. She couldn't draw faces. Now, why in the world would somebody with autism not be able to draw faces? Yeah, she never looks at people's faces. Exactly. But there's two things she didn't look at. She never looked at people's faces, but what else didn't she look at? Look at the chicken, look at the rooster, look at the horse, look at the man. There are the man's face is goofy. I mean, it's not accurate at all. But what else couldn't she draw? She only looked at select things.
So look at the rest of the body. The horse at the bottom.
Yeah.
The body is longer, the legs are short.
So the body's perfect.
But the legs.
The legs. Look at the chicken's feet. Yeah. Look at the man's boot. The man's boot, yeah. So there's two things that she never looked at. She just looked at the middle of the person or the middle of the animal. She never looked at their feet. She never looked at their faces. Even the chicken's face. Look at this chicken's eye. Have you ever seen a chicken with an eye that looks like that? I know. Isn't that weird? And look at her head. Look at the chicken's head. My God, it looks like somebody decapitated it and stuck a rock on top of it or something. I know. Yeah, so she never looks at faces, and she never looks at feet. She has since died, of course, but these are very famous drawings. You could buy these drawings that she made. I mean, they were very anatomically correct from the knees to the neck, I guess, but the rest of it is kind of off. She can't draw faces, and she couldn't draw feet. Just fascinating. Autism spectrum disorder tends to run in families. About 5% of siblings of autistic persons also show the condition. Remember, on the same gene that we have autism, we also have ADHD, we have major depressive disorder, we have bipolar disorder, and we have schizophrenia. All of these problems have a genetic component to them, and they're all on the same gene. Twin studies support a substantial genetic contribution. There have been positive linkage reports for every chromosome that we're dealing with. At least 188 candidate sites are being investigated. We can't figure out where it is. The point is that what we're trying to figure out where autism comes from, we're trying to figure out where schizophrenia comes from. If we can figure it out, then potentially we can go in and correct that gene, potentially. Of course, we're not exactly sure how we're going to do it, but we are doing some of that now. We are taking embryos, and if there is a select flaw, we can go in and we can change that gene. Remember, all humans are identical. 99.1% of your DNA is exactly the same as the person sitting beside you. I know, there's nobody sitting beside you. You're so unique. And despite the fact that I'm a completely different, from a different race, a different ethnicity than you guys are, I still have exactly 99.1% of my DNA is exactly the same as yours. How about that? I know. You poor alien. You probably figure, oh my God, I'm the same as this alien that's standing in front of me. He's not sensitive to opiates and can't drink coffee. And ibuprofen makes him depressed. What's wrong with me? Okay, there's been a positive linkage report for every chromosome. Okay, we already talked about that. DSM-5 reports that 15% of the cases are known to be associated with specific genetic mutations, with the remaining risk polygenic and diffuse. Whoops. And diffuse. Autism spectrum disorder shows higher serotonin levels than unaffected persons. Wait a minute. So they have more serotonin than we do. Wait a minute, how in the world is that? How can that possibly be true? So they're happier than we are? The non-autistic people? Does that make sense? Remember, I have a friend, and he could be in a fraternity party with all this chaos going on around him, and he's reading a textbook, and he's actually understanding the textbook. I can't even sit in a quiet room and read the same damn textbook he's reading and get nearly as much out of it as he does at a fraternity party with people spilling beer, with semi-nude people wandering around, and he can concentrate on that textbook. Does that make sense? Well, not to me, because I can't even do it in a quiet room, but he can do this in the middle of chaos. So yeah, it makes sense that his serotonin level is higher than that. That he's happier than I am.
Wouldn't that be kind of like the same where some students, they like to draw, like during lectures?
Right.
They can,
That's a good point.
but when they stop drawing,
They can't remember a damn thing that I said. Or maybe I didn't say anything important. That's a possibility too. Unfortunately, that's too close a possibility. Brain growth for infants has been reported to be accelerated in the first 2 years, followed by a slower than normal growth period, so that brain size is in the normal range by early adolescence. So this individual starts out with a larger brain than a normal child. Then it slows down to the point where it's smaller than it's supposed to be. Okay. But by adolescence, everything is the same. Abnormalities of cerebellum and amygdala have been reported in autism spectrum disorder. Is this causal, though? That is the question. Cerebellum. Cerebellum has to do with movement. Amygdala has to do with emotions. These individuals don't usually display emotions, do they? So if they don't display emotions, maybe the amygdala is smaller because they don't use it as much. So it's not as stimulated. Cerebellum. Repetitive movements. Maybe that's why it's smaller. All they do is the same movement over and over and over again. Repetitive movements. So maybe it's not causal. That's my point. No consistent or unique abnormality is present. It is not possible to diagnose the disorder by means of any anatomical or biochemical markers. If somebody had autism and they were standing right here, and you looked at them, you would know that they had autism. Yet, I can't draw blood on that person and find out if they have autism. I can't do a blood test, I can't do a saliva test, I can't do a urine test, I can't do anything. I can't do a brain imaging test and tell that they have autism. But if you looked at them, you would know that they had autism by their social interaction. Okay. There you go. I know. So you're smarter than the MRI. How about that? I knew that anyway. Several studies have examined the possibility that the increase in this disorder over the past 25 years could be due to the increased use of medical vaccinations such as measles, mumps, and rubella. Does anybody watch Big Bang? Do you know who Amy Farrah Fowler is? In real life, Amy Farrah Fowler is a PhD in neurobiology. She really is. She has a PhD. But she also supports the idea that vaccinations cause autism. I know. Does she have any proof behind it? No. She has anecdotal evidence. So there has been this story out there. And unfortunately, of course, most people don't read scientific journals. What they read is the internet, and then they find something that it's over here on the right side, and it says autism is caused by vaccinations. And then they click on it, and now they've got all this proof because Dr. Jones from Oxford University said that this is a possibility. And now, so they believe it because there's the proof right there. Dr. Jones said so at Oxford University. Because Dr. Jones was at Oxford University 50 years ago. He has no research to back it up. Or maybe he never said it. Anyway. So there is a conspiracy theory out there that the MMR vaccine is causing autism. To date, studies have not found any evidence that vaccinations or mercury exposure is associated with autism spectrum disorder. For a while, they thought it was the fact that they were using horse serum to make their vaccines. But now there is no proof. We have changed our vaccines. There is no horse serum anymore in vaccines. So this is one of those things that somebody came up with the idea, and it has just never gone away, unfortunately. So if you have children, please get them vaccinated. Please get them vaccinated. This really caused a problem in California. It was like 10% of the parents weren't vaccinating their children for one reason or another. Then they had an outbreak of measles.
Immunization, you mean?
Immunizations. Getting vaccinated.
Sounds like vaccinating livestock.
Oh, I'm sorry. Yes, vaccinate your livestock and your children, but not at the same time with the same person. Let's find some
syringe.
Yeah, stick it in the cow, stick it in the kid. Okay, there we go. To date, studies have not found any evidence that it causes autism. Stimulant medications and newer antipsychotic drugs such as risperidone have been used, especially those with hyperactive symptoms, self-injury, and aggression. So if the child has a problem, yes, we need to treat that problem, especially if this problem is destructive to the child or to somebody else. Yeah, we need to take care of that problem. If they don't have any problem like this, then you don't really need to give them anything. You don't need to stop any behavior. It's the behavior that you need to stop, not the fact that this child has autism. You're not going to fix it anyway. Selective serotonin reuptake inhibitors have been prescribed to reduce repetitive or compulsive-like behaviors, especially if that behavior is destructive. They will give them SSRIs. You really don't want to give this child anything. Because if you give them something, then you're going to change their behavior. If you give them SSRIs, it's going to sedate them to some extent. If you give them antipsychotics, it's really going to sedate them. And you don't want to do that. You want this child to grow up as fulfilled as possible. The more you sedate them, the more subdued they're going to be. The stimulant methylphenidate reduces symptoms of hyperactivity among autistic subjects. Methylphenidate, of course, is Ritalin. So you're giving them a stimulant. There is no consensus on the relative effectiveness and safety of any of these approaches. We try not to give them anything. That's the best process. A variety of treatments for autism spectrum disorder have been promoted. Vitamins and minerals, special sugar-free or gluten-free diets, chelation therapy to remove the heavy metals from the body, auditory integration therapy, craniosacral manipulation, secretin, sensory integration, facilitated communication, and holding therapy are all therapies that we have used. On select individuals, they work. Possibly you have somebody with a allergy to gluten, and of course, as soon as you take the gluten out of their diet, they improve. Sometimes if you give them vitamins, because they're not eating very well, as soon as you give them a vitamin therapy, they improve. So this is a possibility. Sometimes they're in an area, especially if it's a poor area, and they live in inner city New York or Chicago. A lot of that paint has lead in it. So if we chelate them, if we take all the heavy metals out of their system, if it were somebody here and we had that problem, it could be uranium. The fact that there are so many uranium mines around here. Now I told you that there is an overabundance of individuals suffering from autism on the Fort Belknap Reservation. But on the Fort Belknap Reservation, right off the reservation, in a part that the federal government stole from the Indians, there were gold mines. And how did they get the gold out of the riprap, the scrap, the rocks that they dug up? How did they get it out? They used cyanide leaching. Cyanide leaching, and then the cyanide got into the, of course it's a heavy metal, the cyanide got into the water supply. And now we have all these kids with autism. We also have kids with lupus, or we have adults with lupus actually. And the kids, we have over a cluster of kids with autism. So some of these things will work because potentially they've been poisoned. They aren't taking in the proper vitamins. They have a food allergy, or they have a heavy metal problem. They are ingesting too many heavy metals. There's a paucity of research without substantial empirical support for any of these interventions. And the problem is, of course, we don't know what their problem was to begin with. Why don't we stop right here? We'll pick this up next time, and I'll talk about attention deficit hyperactivity disorder. We're going to get through this chapter. I think this